Welcome back, everybody. We're now in our final session of this 5th Assembly meeting and continuing on the whole area of perspectives. This section actually, we're looking at the whole issue of governance and funding of the sector. And we have some good panellists, which I'll introduce you one by one as they come to the podium. Can I get everybody's attention, please? We're formally back live again. Okay, first of all, I'm going to call on Jim Walsh. Jim has previously presented to us from the Department of Health, Senior Official with the Department of Health, and he's going to present on, as it says here, some of the funding and governance issues that overall related to the drug strategy. Jim, thank you. 10 minutes.
Good morning, everyone. Thanks for the opportunity to speak to you again. Been following you very closely, been here for a lot of your deliberations, discussions. I spoke to you back in June just to say how valuable the work you're doing, how interesting it is, how engaged I see you are, and the issues you're bringing up and discussing. Just fantastic. And I am learning an awful lot from this whole process, as I'm sure you are. So I just want to acknowledge your contribution there. So today, what I've been asked to do, a lot of information. I'm not outlining any new programs or anything like that. I'm telling you how the system works, okay? How the funding works, how the governance works. And then, so you are able then to take that information and say, right, we need to change this and we need to change that. So I'm here today, the title of my talk is Enabling Change, okay? So how do you enable change? And using the two levers of funding and governance. And I want to be a resource for you in your deliberations. So I'm not here to tell you, I'm here to share with you information which you can then use to inform your recommendations, okay? So please, that's my role, a resource. I'm not here telling you anything specifically in sense of what you should do or what you shouldn't do. So I'm looking at two topics, funding and governance. So it's kind of the bricks and mortar. A lot of your focus has been on policy and new programs, whatever. This is the bricks and mortar. How do you actually deliver change and make it work? So what we're looking at here is the resources, the funding that's available, the level of resources, how it's allocated, and how we get additional resources. And then from a governance point of view, this is about the process of making and enforcing decisions to do with drugs policy. How is that done? What are the structures and how is changed, how can you change those structures? So the first one there I want to speak on is expenditure. So what I have here is what's called labelled drug-related expenditure. And this is gathered and reported by the Health Research Board and presented to the European Drugs Agency. So this is the definitive official way of measuring drug expenditure. So we have a total drugs expenditure in 2021. The figures 22 aren't available, will not change very much. So 238 million in labelled government expenditure on drugs. And I list them down there. And you can see the big expenditure item is health with 146 million or 61% of the total. But the other departments are also contributing as well. Okay. I should just mention this is labelled. It does not include unlabelled expenditure. So, for example, people who end up in hospital for a drug-related issue and cost the health system for treatment, that's not included. It doesn't include the cost of prisons and running prisons if people end up in prisons. So those unlabelled costs are not included. It doesn't include the productivity costs of people dying prematurely. There is an estimate there, if you were to include those costs, you would have another 147 million on top of the 238 million, okay? So there are indirect, unlabelled costs as well as labelled expenditure. Hope I'm not confusing there. So jumping on then to the health expenditure, so that's the 146 million. So there's three components to that. In the blue, the 65 million, 65.6 million, that's given and spent by the HSE on addiction services. So these are the services provided by the HSE directly. Opioid substitution treatment, all the services that will be provided comes under that. The second big category at 57 million are community-based services. So these are services provided by what they call Section 39 organisations, the likes of Tiglin, the likes of Family Base, the likes of Analifi. These are almost 57 million spent on that. And the last category there, 22 million, is spent on GPs and pharmacy. So that's GPs who administer opioid substitution treatment, pharmacies where the drugs are sourced from. That's a cost of 22 million. So that's the breakdown of the package. Just in terms of the reporting of that, there's a whole reporting structure associated with that expenditure between the HSE and the Department of Health, where we set out key performance indicators and measure how that funding, what is actually delivering in terms of services. So it's not just a question of handing the money over, it's also seeing how that is used. So the next thing I want to look at then is the budget process. So the budget process, or the estimates process, is the way in which additional funding is sourced for drugs policy. Okay? And what I do here is I show the money that has been allocated in addition over the last four budgets, from 2020 to 2023. So, for example, that's broken down into two categories. One category is what's called new development. So we decide, hey, we want to do a new service, so we have to source the funding. That's the green category. So the average there, say, over those 4 years is 4 million. So we get an extra 4 million for service delivery in the budget in the last 4 years. The blue then is for maintaining existing levels of services. So, for example, a service is there, that there's a bigger demand for it, and the blue provides additional resources there. I suppose what you can take out of this is the amount of money are fairly small. It's a bit erratic in terms of the year to year, but that's the budgetary process. There's nothing given in the budgetary process. You fight for everything in terms of the allocation to the Department of Health, and then within that, what is the allocation for drugs policy? I've given out with the material a fact sheet on the money we got in 2023, which summarises how we used the 4+ million in 2023. So let me just give you two examples which are relevant to what we were discussing this morning. So in budget 2023, we provided 200,000 to Tiglin to provide an aftercare service for women. Okay, they came, this proposal came up, we gave them money, and now they're providing that aftercare service for women. It was identified as a need. Another example, we were talking there about family services. We provided 500,000 in budget 23 for family support services. And a lot of those resources have gone to the likes of Family Base and other services working with hidden harm. So they're just examples. Third example, we allocated 500,000 in 2023 to increase service delivery for cocaine. It was identified the demand for people needing cocaine services, so we allocated 500,000 and the HSE provided that for services.
Just 2 minutes, Jim.
Okay, just jumping on. So looking at the governance of the drug strategy, just very briefly here, there's maybe 4 levels to it. I think we have a very sophisticated model of governance. Could it work better? That's maybe get your views on that. If we look at this, we have the Cabinet Committee on Social Affairs and Public Services. That brings together a whole range of policy areas, including drugs. We have a Minister of State. We have the Joint Oireachtas Committee on Health. We report to them. And then at the next level, you have the Department of Health. We have an Oversight Committee. We have government departments. And then below down, you have other agencies as well. I want to mention in particular here, civil society. Okay? So that's what you might call NGOs. So we have recognised civil society as a partner in the drug strategy. And it recognises that they're there not just simply as service providers, but as part of the wider civil society effort.
Just 1 minute, Jim.
And we have representation on that on the National Oversight Committee, and I detailed there the membership of the committee. So I'll just jump on from that. So this is the drugs policy unit that I'm in charge of in the Department of Health. again gives you a sense of where we fit in the infrastructure. Just to note that Drugs Policy Unit has 15 staff. We have a remit also on social inclusion, so it isn't just purely drugs. We also deal with issues like homelessness, healthcare services for homeless, and also for travellers. So that's that. Just want to mention then about our strategic action plan. So the delivery of the National Drug Strategy is done through 2-year strategic action plans. And that's the one we have at the moment, and that we're the one that we're delivering, and you'll get more information on that on our website. Lastly, I just want to flag here
have to finish, Jim, on this,
yeah.
please, quickly.
An audit of drug services that we're carrying out at the moment. So we're looking to see what is the level of provision of drug services across the country, and how can we identify where the gaps are, and use that information to inform the new health regions being established to deliver our service. So I'll leave it at that. Thank you very much.
Thank you very much, Jim.